So let's talk about sex. Do I have your attention? Hi, everybody. I'm Nicholas Snow. This is a special edition of the Nicholas Snow Show on PromoHomo.TV. My pronouns are he, him, and his. And the reason this is a special episode is because this is one of 6 particular episodes I'm doing this week to celebrate the 36th anniversary of Desert AIDS Project. But wherever you happen to be in the world, this is a relevant information for you. What we're going to talk about in general regarding risk when it comes to sexual involvement with others during the age of COVID and HIV and a combination of other potential sexually transmitted diseases will be of relevance to anybody watching from anywhere in the world. My guest coming up in a couple of minutes is CJ Tobe. And CJ is the Director of Community Health at Desert AIDS Project. He says, I will do anything to help someone get tested for HIV and other STIs if they want. I describe him as a fierce advocate. He's passionate about eliminating barriers to allow everyone access to health care services. And we're going to learn more about CJ coming up. I wanted to say, just for full disclosure, that for many years Desert AIDS Project has been a sponsor of my media endeavors, but this series of episodes that I'm doing are editorial and journalism and not advertorial, which is advertising disguised as reporting. I don't do that on my show, and I'm passionate about Desert AIDS Project, and I wanted to bring this series of programming to you. So with that said, I also wanted to let you know if you have questions or comments that you want to express during the program, we can actually put your questions and comments live on the screen. And with that, I'm going to be back in a moment with CJ. So we are talking about sex in the episode today, but I first want to remind you that if you comment during a live broadcast, your comment may be featured on screen. And we already have a comment from Sunny Rose Berger. She says, happy anniversary, D.A.P. Thank you for all that you have done for the community. And Sunny, thank you. Sunny is with the Life Group LA. You can find them, I think it may be the lifegroupla.org, but you can Google them and find them. They're a fantastic organization. So without further delay, I want to welcome to the show CJ Tobe. Hi, CJ.
Hi, Nicholas. How are you?
I'm great. It's so nice to see you and have you on the show. And one of the reasons I'm excited is because I consider myself an activist, and I'm often creating shows that I think are very important, but there's not always a real high level of interest in them. And so here I get to combine all of my passions, pun intended, to talk about sex and community health. And as we begin, even though we're going to talk about news of interest to everyone everywhere, why don't you talk about the Community Health Department at Desert AIDS Project and give us an overview of what you do there?
Absolutely. So the Community Health Department, I can tell you, it changes all the time. we're constantly adapting programs to deliver services to whatever the needs of the community are at that time. And I can say through the last 5 months with the COVID crisis, it's been no different. We've really taken all of our HIV, hepatitis C, and STI testing programs and education, linkage to care, our PrEP and PEP navigation team, and we've adapted them all to either be virtual or do testing and education through a mobile unit. We've completely adapted all services in this department to meet the needs of the community, to obviously provide the much needed sexual health education and services, but also to limit COVID-19 exposure.
Speaking of which, there's a whole new development around how to be safe sexually during COVID, when most people equate that as wearing masks and social distancing, which clearly neither one of those are happening if there's body to body contact of some sort. Let's get into some things that, in a way, is sort of titillating. I just want to remind the viewers that this program is not marked as being for kids on YouTube. But if you have kids around and you don't want to expose them to this content, then I'm just giving you forewarning. We're going to have a fairly adult, open conversation, which I think is important. So, CJ, you were telling me about some breaking news out of Canada, and I think you mentioned one other place. So, let us know what that news is.
Yeah, so Canada and then also the New York State Health Department, they've actually endorsed and have been promoting glory hole sex during this COVID-19 crisis because they, like D.A.P, we understand that people are still going to be having sex. We understand that shaming people is never useful. It solves nothing. And we learned that through the AIDS crisis in the 80s and 90s. But providing education and options to people is powerful for them to make informed decisions about what they want to do with their body. And so Canada and the New York State Health Department have actually started marketing and endorsing the use of glory holes now during the COVID crisis as another way for people to be able to engage in sexual activity, but still limit their COVID-19 exposure.
So, for people that may not know, you're the community health educator. So, I'm interested in hearing how you would explain to someone what a glory hole is.
So I would describe it as being some sort of barrier that you put between you and your sexual partner. It could be a sheet, it could be plywood, it could be metal, it could really be anything that you encounter. You see them at sex resorts, bars. Some people have them in their house, garages, really all over the place. Sometimes I think even parks in certain areas of this country even have those. And then that's a place that people are then able to engage in sexual activity through a hole.
And to be more specific, they would generally be used for one man to insert his penis through the hole to receive oral sex, to get clinical. Now, one of the points you make, and I think it is very important, is that when the HIV and AIDS epidemic began to show up, and long before that, and still, a lot of natural human sexual behavior is stigmatized and also oppressed by religion and culture and all sorts of things. So I personally want to acknowledge Desert AIDS Project and similar organizations that have been working for decades to celebrate human sexuality in all of its forms and to help people navigate through their living experience being as safe as possible. With that in mind, I had the opportunity as a client of Desert AIDS Project, and I am a grateful client living powerfully with HIV, to participate in a Zoom meeting that you had for clients, along with other people from the agency. And in that meeting, and right now, I would love for you to talk about just the different suggestions that you've been making to the community in terms of dealing with their own sexual needs during COVID.
Yes, Nicholas, thank you. You were on that wonderful call. That was an exciting conversation that night. And I think the first thing that we need to discuss, which is we need to continue to openly discuss about sex, sexual health, everything involved with it, right? And when we go in and we start talking about sex, we're not promoting, D.A.P is not promoting or condoning sex during this COVID crisis. We're just under the understanding that we're about providing education to people, knowing that people are still going to be engaging in sexual activity for multiple reasons, right? Some people have sex addiction. Some people are having survival sex just to make sure that they have a roof over their head and food in their tummy. Others are they're escorting or they're giving massages, so they know that maybe sexual acts are not happening, but the close body rubs and human contact is happening. People also have behavioral health concerns, and people are using drugs. So there's a whole multitude of reasons of why people are engaging in sex during, a pandemic like COVID, where people are adamant about yelling at everybody and shaming people to say stay home. Um, and I'd like to just mention, I'm a big believer in harm reduction. And I know this example will probably roll some eyes for some people. I love it because I love food, and I practice harm reduction on food every day. And we have access to pizza, most of us, right? Or McDonald's all the time. We know through numerous studies throughout years that that food, if we consume it routinely every day and in large amounts, is not healthy for us. So we go once a week, some of us, right? Some of us may go once every 3 months. And so if we look at sex that way, as it's a spectrum. Where do people fall on that spectrum as far as their sexual life, their sexual partners, their sexual behavior, and their needs? And our job is to then promote, right, that education and provide resources and tools to people so they can make their own decision about their body.
That's very well said. I mean, people are going to be having sex. One of the things that I'd like to bring up, though, in addition, there's no though about it. One of the things I definitely want to make sure that we bring up is that um, the fusion of meth abuse and sex addiction are very common within the gay male community in terms of the mix of drugs and sex, and often that is problematic. And I'm curious to know if someone, for example, is seeking treatment, a diagnosis for a sexually transmitted disease in your clinics. What sort of screening process helps you identify if there are other things that are going on that you might empower the patient, the client, to then access a greater level of support?
That's a great question. And I can tell you that anybody that walks through our sexual health clinic, the doc, where the sexual health clinics are now in our blue clinic, anybody who walks in there for STI testing or treatment are assessed for behavioral health, insurance, drug use, and a whole range of different services that we provide here at D.A.P. And if somebody discloses that they're having sex under the influence of alcohol, meth, heroin, pills, then we offer support to them. We listen to them, we empathize with them, and we see where they are right now in their journey of life and see if they're ready to seek counseling. And a lot of people, when we see them, they're not ready for counseling. But we also understand that there's other steps that we can take to get them to counseling. So then we start talking about, when do they use drugs, right? What time of day? Is it normally at night? If it's at night, then are you bringing condoms with you? Are you taking PrEP? When do you take your PrEP? Do you skip your PrEP doses because you're getting high? So maybe you should take your PrEP before and alter your dosing time schedule. So our staff in the community health department and also the doc staff are all trained testers and risk reduction counselors through the state health department. And they have judgment-free, open conversations with everybody that walks into that clinic.
Judgment free and open is so important when it comes to reaching people about so many different things, which is why a lot of people want to choose a place like Desert AIDS Project for their health care, because even today in 2020, there are anti-LGBT or anti-trans physicians, or physicians or healthcare providers that are just anti-sex in general. And it's hard to really be completely open and honest with one's potential health challenges in an environment of judgment and shame.
It is. Unfortunately, shame and stigma is still there for sexual health, with HIV, with drug use, right? Even behavioral health. We're in the middle of a pandemic right now, and I don't, I guess I can't, I don't understand how not everybody is seeking behavioral health care at this time. And I think it's because the stigma and the shame that is resonated with that, thinking that we're weak or that we're crazy if we're going to go seek behavioral health by a professional. And there's nothing wrong with coming in and taking control of your sexual health, your behavioral health, your oral health, your everything about your body. Have conversations about it with family, friends, sexual partners, and then get linked to your doctor. Talk to your doctor and have an open conversation. And I can tell you that we can maybe even educate some doctors across the country about sexual health who may not have had those open conversations before with patients. And as we give that experience to them, we share with them, I'm a gay man who has multiple sex partners and I have condomless sex, and I want to talk to you about that. What can you do as a physician to help me set me up to remain HIV negative, right? Or to make sure that I remain undetectable if I'm living with HIV. To just develop that relationship with your professionals, and learn from each other's experience, and you continue to grow together.
Let's break down some of those terms for people that might be new to the subject matter. So, talk in general about the meaning and connection between undetectability, PEP, and PrEP.
Yes, so undetectable equals untransmittable. So if you have a person living with HIV and they're taking their HIV medications as prescribed by their doctor, also known as they're adhering to their medication or their treatment plan, the viral load, the amount of virus that's in that blood, will reach undetectable status, which is below 200 copies of HIV. And then once they become under the 200, they become undetectable. And it's been proven through science that once somebody living with HIV obtains undetectable status, they cannot transmit the HIV virus to an HIV negative partner. That was a huge finding. It's also called treatment as prevention. It's really kind of empowered and destigmatized people living with HIV to really embrace sexual health and being able to have a conversation with their HIV negative partner to say, I'm undetectable. And if we use a condom, great, it's going to protect against other STIs. If we have condomless sex, I'm not going to give you HIV because I'm undetectable. And then PrEP and PEP. So PrEP became FDA approved in 2014, called Truvada. And then Descovy is another medication that was approved last October by the FDA. And so what PrEP is a one pill, once a day regimen for people who are HIV negative that they take every day to stay HIV negative. And a lot of people then will go into PEP, which would be post-exposure. And post-exposure is when somebody has an occupational and accidental needle stick, or a condom breaks during sex and you're unsure of what your sexual partner's HIV status is. As long as you come to the emergency room, you go to an urgent care, you talk to your doctor, or you can come into the doc here at Desert AIDS Project within 72 hours of possible HIV exposure, we will then give you PEP, which is 2 medications that you'll then take for 28 days, and it will help reduce the chances of you contracting HIV.
Now, so when I was in college, coming out of the closet in the early 80s, in our community, by the way, we're both alumni of Arizona State University. I saw that in your bio. I think I graduated about the time you were born, but other than that, we both went to the same school. But it was common to be able to go to a free clinic to have STI and STD screenings. And I'd love for you to talk about the different ways that, and communities in general, people in communities in general who are watching this, there is most likely STI and STD test and HIV testing available to you in your community if you are not in a position to pay. That's most likely a reality for anyone in reach of this. But for people living in the Coachella Valley who want to access the doc, which is your sexual health clinic at Desert AIDS Project, how do they do it? When is payment required, and what forms of payment do you take, from insurance to cash, etc.?
So currently, anybody that comes into the doc for HIV or hepatitis C testing, it's completely free. Anybody who does STI testing,
You just muted yourself.
oh, I'm sorry.
There we go.
I
That's
got
okay.
click happy, I guess. My hands aren't even anywhere near the computer.
That's
So,
okay. You're magic.
right? I'm doing it without any hands or arms.
Okay.
So it's $25 for STI testing and treatment at the doc. Any HIV and hepatitis C testing is completely free right now.
Okay. And if someone has no money at all, period, are they able to go to the dock or anywhere else in Riverside County or the Coachella Valley?
Yes. So if somebody is undocumented, or if somebody has no income, or they have some income but they need that $25 to pay for food, there's questions that are asked when a patient comes in, and if they're unable to pay, then we will waive that fee for them, and they will still get the STI testing and/or treatment.
Okay, that's fantastic. One of the things that we were talking about earlier is stigma, and while not necessarily directly under your purvey, Desert AIDS Project is developing a transgender center of excellence. I don't know if that's the specific term they're using, but you also, I'm just glancing over at your biography. One of the things that you did was you worked in developing programs that were integrated in a group called Transcend in Colorado, which was the area's transgender, non-binary, and cross-dressing advocacy organization. You also helped develop a needle exchange program, and other really important things that, in many ways, there have been opposition to. So I'm wondering, what have you learned in that experience that you've been able to bring to your role at Desert AIDS Project?
Yes, you just asked a loaded question that I could talk about for 2 hours. But in Colorado, I was given the opportunity to start up a men's program focused around HIV prevention. And I went through the CDC training, it's the empowerment model. And I was able to bring that then back to Grand Junction, Colorado, and build a men's program that was focused on HIV prevention, but it was also through doing volunteer work. It was also through building relationships with other people in the LGBTQ community. And so we took that men's group called Empower Colorado, and we started building relationships with Moji, which was the youth organization in Colorado, and then Transcend. And we started having conversations about trying to connect these groups together, because we're all marginalized groups and we're stronger together. And so we participated in monthly game nights and potlucks with the group called Transcend. And I can say that's probably one of the most, I would say one of the most things that I missed the most in Colorado was just that relationship building with people outside of the letter G, which I think really holds a lot of people, from experiencing what other people are going through and learning from others. And if we venture outside of our box, they learn from us, we learn from them. We learn about our stories and our struggles and how we can move together and co-create the best future moving forward.
You mentioned Colorado, and I don't want to forget that we both agreed we were going to give a shout out to our mutual friend Sandy McLaughlin in Telluride. So, hi Sandy, we're thinking of you.
Hi, Sandy.
Uh, CJ, is there anything, and we have plenty of time, but is there anything you want to dive deeper into or even bring up for the first time that we haven't addressed so far in our conversation?
Well, I think listening to George Sonzel talk, I've watched his video twice now. You did an amazing job interviewing him. And then Dr. Morris, there were some comments that were made about the history of Desert AIDS Project. We're celebrating 36 years, and people continue to talk about learning from the past. And I can say I was born in 1986. So I was born right when the AIDS crisis was starting. I obviously was too young to know anything about that. But all the knowledge that I've been able to get has been through having conversations with people who are older than me, people who have lived through the 80s and the 90s, through this AIDS crisis, through the social movement of just having rights to marry and hold hands. And so I guess this is more of a call to action to the younger generation, because the foundation, the sidewalks that we can walk onto freely in most of this country is because of the people who've come before us, who are much older than us, who've laid that framework. And I strongly encourage that we take the time out of our lives to respond to that message, to some older guy that's sending us a social media message, to have a conversation with them, to go have coffee and have that conversation and learn from the experience. There was something that was mentioned 2 days ago about learning from history so we don't repeat it. And you mentioned our alma mater and sharing the University of Arizona State. That's actually what my undergraduate work was history, because I'm a big believer in looking at the behavior of groups of people and learning about what has happened for centuries before us and how we can bring people together to create a beautiful future, that people have access to services, healthcare services. If you don't have good health, you don't have anything. And that's why I think my sole purpose and mission, I would say, in life, besides me personally being happy, is I want everybody else to experience happiness and to have access to what they need as far as healthcare is concerned.
For people who are watching that may not be familiar, so this is part of a 6-part series of special episodes of the Nicholas Snow Show that are celebrating the 36th anniversary of Desert AIDS Project. And the first broadcast I did was with George Sonzel, who was the first executive director of D.A.P. in 1984 when it achieved its nonprofit status. And then the next episode is a rare public interview. He's with Dr. David Morris, who's the chief medical officer of Desert AIDS Project. Getting back to you, earlier in the conversation, CJ, I mentioned it was sort of a joke that I probably graduated from ASU the year you were born, but in you reciting your date of your birth, I'm flustered. I realized that, okay, you were born in 1986, and I graduated from ASU in 1985. But you might be interested to know that my internship as part of the College of Public Programs, my last semester of college, I got 6 credit hours for doing what was known at the time about HIV, AIDS, and the LGBT community. So I was already a flaming activist before you were born.
And I want to say thank you, because activists like you and many others around the world, to really get us to where we are today. And we know that we have a long journey ahead, and there's a lot more work to be done. But I think it's better time now more than ever to really reflect on Desert AIDS Project's 36th birthday, to really reflect on all the people that have come before me and us, and just say thank you for the amazing work that you have all done. I know it was your life's mission to really react to a crisis during that time. And it was interesting to listen and hear that the founders of Desert AIDS Project, to never envisioned that Desert AIDS Project would be this big or even still be around 36 years later. And so I sit here today, and we're in the middle of another pandemic, which is the COVID crisis. And some people can compare and contrast the COVID crisis to the HIV crisis. But where will we be 36 years from now? What will Desert AIDS Project look like 36 years from now? Will we still be battling COVID? I hope not. I hope there's a vaccine in the next year. But if you look back, 36 years ago when the AIDS crisis was going on, a lot of people I talked to, they were hoping, there would be some kind of cure, that there would be a solution that would come. And through 36 years of hard advocacy and blood, sweat, tears, and loss of lives, we've made tremendous progress. We went from people finding out that they had AIDS and passing away within 24 to 48 hours to now it's one pill once a day and people can live powerfully with HIV. So with that said, I would like to say that right now during present day, during this COVID crisis, things may be difficult. It's not easy for any of us, but we need to remain hopeful. There's light at the end of the tunnel. We need to trust our medical experts. We need to wear masks. We need to wash our hands. We need to take care of ourselves so we can protect the community. And I truly believe that together we will survive this, and it will open up more doors, technology-wise, and providing even better access to people who need it most to improve their life.
That's all well said, and I have to say I just really love the depth and scope of our conversation today. To bring it to a more personal level for me, I became HIV positive in 2007 because of a rare slip in my safer sex behavior. I was dealing a bit with depression. I was sober, but there are a variety of factors at play that led me to that decision. And it was a human decision. So I made a decision to go public with my experience, to give a name and a face to HIV and my own story to hopefully inspire and empower others. And at the time, CJ, they weren't putting us on medication immediately. They were waiting for T cells to drop below a certain amount. So I started on antivirals in 2010. Within a month or two, I was undetectable and have remained undetectable ever since. And in terms of my own decision, I'm not really having casual sex or hookups. But if I were to be in a long-term relationship with someone, that's still part of my vision. I want to be with someone that feels comfortable in the reality of the science that undetectable equals untransmittable, and isn't concerned for their own safety or well-being if they happen to be HIV negative. I wouldn't work well in a relationship with someone that felt like they were at risk of getting HIV from me when it's scientifically not the case. So that's how I'm sort of navigating these things in my own life. And the other thing I just want to say is that I find it has been so freeing for me to disclose my HIV status on such a huge level that it's become extremely matter of fact and incidental. Of course, I live in a community that makes that a little bit more possible, but even in our community, there's still a great deal of stigma targeted at those of us. And I don't know what your status is, but in my own case, I have experienced a lot of stigma and discrimination still, especially when it comes to the way that gay men most often meet each other in the electronic world. So just wanted to throw that more personal experience out there. I want to give you the opportunity to respond to anything that I might have said, and then I have one final question for you.
Absolutely. So thank you for disclosing all that. And I know the power of your voice and embracing your status and being a huge advocate is absolutely amazing. And I think that your voice, and the voice of other activists and the hard work is changing the lives of so many people. And HIV stigma, it's still very real. And I can tell you that I use social media apps and I've been very transparent about that. And we've used it in different interviews and blog posts. And I have in my profile, if you do not know what U equals U is, undetectable equals untransmittable, or PrEP and PEP, just please ask me. And I can tell you that when I have time to get onto social media apps, I have a list of questions from people just about sexual health questions. And these are people who are 18 and they're, and they're 60 years old and they've been a gay man their entire life who do not know what these terms mean. And so it's empowering for me to know that the work that I do for the community is meaningful and that it's needed because so many people do not know what these words are. And people that don't know what these words are, that's when the stigma comes about. It's because of the unknown, the inexperience, right? They don't have that knowledge. And so once they get the understanding of, oh, okay, so if somebody living with HIV is undetectable, then I could have sex with them and not get HIV. Yes, you can kiss them, you can You can have oral sex, you can have anal sex, you can hold their hands, you can do a whole bunch of different things. You can do anything you want to with this person. You're not going to get HIV. And I think knowledge is power, and I think it's all of our parts. It's my part, it's your part, it's everybody to just have those conversations with people. You and I are ignorant to a lot of different things, right? We don't know everything about everything. So there could be a person who is living in a country right now who is living with HIV and they can't walk into a clinic because they know that they will be stoned to death for being gay or for having HIV, and that's something that we'll never experience. And so I think that's something that we all need to have those open, honest conversations and be there for one another. And I want to mention as well HIV stigma, but I've also noticed there's a stigma surrounding people who take PrEP or people who do not take PrEP. So there are people who are selective with their sexual partner, saying they will only have sex with somebody who is on PrEP because they know that they're getting STI testing done every 3 to 4 months. And then there's also some people who will not have sex with people who are on PrEP because they label them as promiscuous or slut and having a lot of sexual partners. So HIV stigma is very much alive, and there's also sexual health stigma in general is still happening. And I want to mention one more thing as it pertains to just sex during the COVID crisis. And a lot of people who used to be very vocal about sexual health or being sexually active have now kind of gone back into the closet about their sexual health and their sexual life. And they've kind of resorted of staying off of social media apps. So their face isn't out there because everybody thinks if your face is on a social media app that you're having sex. People are actually going back to cruising. People are cruising in the park, they're cruising in warm sands, and people are having outdoor cruisy sex like it's 1990s again. And so stigma through this COVID crisis has pushed people so far back 20 years to where people are even afraid to jump on an app and have their picture on one of these because they don't want to be stigmatized against right now or shamed.
You're right. We could have this conversation for hours and hours. And I have to say, this is one of my favorite interviews that I've done. And I think that we have discussed a lot of very valuable things. As you know, in the interview that I did with George Sonsell, I talked about how what I was learning and witnessing from people living with HIV and AIDS in the early 80s really inspired me to learn that the most powerful thing I had was the ability to express my own truth and to yield my own life force. My final question for you is, what was the moment, if you can pinpoint one or event or series of events, that really helped you identify and follow your own dreams?
So that's a loaded question that I can give you 2 hours as well. So I grew up in the middle of the cornfield in Ohio, a very loving Catholic family. I did not meet my first person of color, my first gay person, or even really go to a major city until I went off to college. And then I woke up at the age of 23, severely sick, lost my hearing, 90% actually. And then a year later, I found out that I was diagnosed with AIDS on my deathbed. And I had no idea what it was at the time. My life was flipped upside down. I dropped out of school. My HIV status was disseminated across the community. I was slut shamed. I received death threats. It was horrible. And all that happened within 30 days. And so, like many of our patients and clients who come here seeking HIV care, I spent 2010 and 2013 seeing a therapist and really working on my mental health to try to get my life back on track. His name is Dr. Emmerich in Ohio. He's probably one of the few people I would say that's responsible for saving my life at the time. And I ended up packing up a suitcase and $50 and my dog. I jumped on a plane and flew out to beautiful Palm Springs with nothing. I had absolutely nothing. And I did everything to survive except to do drugs at that time. And I moved to Colorado with a partner at the time, and ended up working for Western Colorado AIDS Project. and in case management, and then got into prevention work. And I started realizing that what I was missing this entire time has been, it's not about me, it's about other people. And my full joy in life is when I see somebody else smile, when I see a team do something together, that they get fulfillment out of, because they know that that client out there that was hurting just like I was will now have transportation to come through these doors. Because if you get through these doors at Desert AIDS Project, I can tell you that you are in good hands. You have a compassionate medical team, and the social support workers here, from case managers to EIS workers to the nursing staff to registration, are amazing, world-class, compassionate people who are going to do everything they can to take care of people. So this has been my life calling, and I don't foresee it ever changing. Even if there is a cure to HIV and AIDS, I'm still going to be here, because there's still going to be poverty, there's still going to be drug use, there's still going to be mental health issues, there's still going to be people who are living in pain, and they need someone there, and they need a system to help support them through their struggle, to have them have a happy and healthy life.
CJ, that's quite the story, and I did not know that you experienced that, and the way that you came through it and have evolved and climbed the ranks within the professional response to HIV and AIDS, and fairly quickly within Desert AIDS Project as well to a senior management position. It's just so well deserved, and I'm grateful as a client of Desert AIDS Project that I have people like you taking care of me and the whole community.
Thank you, and I'm a firm believer, and it's not about what you say or what you do, it's about how you make people feel. And that's something that I wake up every day and I look at the mountain, and I'm grateful for being here. I'm grateful for being in Palm Springs, for working at an amazing organization like Desert AIDS Project, but ultimately just serving the wonderful community of the Coachella Valley, and helping people in need.
Well, thank you, CJ, for being on the show today.
Thank you for having me.
If you hang tight, I can speak with you briefly after the show.
Sounds great. Thank you.
Well, there you have it, an amazing conversation with CJ Tobe, and you can find so much more at desertaidsproject.org, including CJ's complete bio, because there's a lot more information about him. And because of the nature of this episode, I just wanted to tell you that I wrote a book called Life Positive, A Journey to the Center of My Heart, which I describe as a living powerfully with HIV memoir. And I also created a music video campaign called The Power to Be Strong, which is subtitled in 21 languages. And in the video that closes my show, you can learn more about both of those. And until next time, I'm Nicholas Snow.